Pilot boys in the building. Let's go.
Pilot boys, we get on up. We don't fly, boys, we getting up.
You are listening to the Pilot Boys podcast. We are joined by a very special guest. I mean, a rock star right now, MD, MPA, public health physician, professor, and one of America's leading healthcare policy experts. You probably see him every night pretty much on MSNBC, Dr. Vin Gupta. Thanks for joining us on the Pilot Boys podcast.
Thanks, guys, for having me. It's great to be on with you.
Thanks for coming on, man.
Yeah, it's awesome. Before we get to the serious stuff, I have a quick question. It's probably funny. You know, you share a last name of someone else who's very famous, who also happens to be Indian, and you know that makes people's heads explode when they see that. So I just wanted to ask a couple of things. One, is there any, what's the most common question you get with that as it relates to Sanjay, and or do you have any funny stories as it relates to that?
The most common question I get asked is, are we related? And it's usually by not people that share the same ethnicity as Viswant and I, because they don't recognize that Gupta is a really common last name. Right. I will say that Sanjay is a hard guy to get a hold of, but I'd love, if Sanjay, if you're listening to this, I'd love to love to get a response back to one of many emails I've sent over the years, but no, I mean, a great example. I feel like, dating back to when we were still this one and I were still shared a similar hallway. I've seen this example for many years. So, and I would say that what I think he does so well is he keeps a calm, neutral sort of equipoise about him, and in spite of what's happening, and whether I'm right or wrong, I find it hard to always stay neutral in tone. So yeah, because he's a good example to look up to.
Definitely.
Absolutely.
Speaking of sharing those hallways, I think we should start with kind of your academic background, right? And I think you and I are both big fans of our high school because it encouraged us to think, right? And actually think about how we wanted to impact the world. Looking at your academic career from Mommy Valley, we all knew you were brilliant then. Not as good of a basketball player, but very brilliant. You decided you have a very, very unique academic path, right? You left Mommy Valley, you went to Princeton, then you went on to medical school. Then you went back, and I think you went to medical school at Columbia, I believe, and then you went back and you got an international policy degree at Cambridge, and then an MPA from Harvard. It seems like on the surface, it's like this guy's just getting a bunch of degrees, right? But when you think deeper and look at what you're doing now, it seems like it was very, very well thought out. Could you take us into that path and like how you decided and structured your academic career to put yourself in the position that you're in now?
Yeah, no, I mean, this one, thanks for the question. And I feel like I'm in a position now where I'm trying to give advice to pre-medical students or, people coming up, and whatever small amount of success I may or may not have had, trying to, pay it forward. And I ask that question a lot. What I realized is, one, I didn't have necessarily, it might seem like it was well strategized now prospectively when you're looking kind of, when you're looking back at it. At the time, I was just doing what seemed right and seemed interesting and trying to be intellectually curious. What I realized was, and I say this to people that ask me for advice, is, be naked with yourself when it comes to what you want to do. And even if it's like you want to be Secretary of State one day, or you want to be a U.S. Senator, or you want to be CEO of a company, acknowledge it and don't be embarrassed to articulate it. I mean, of course, you have to be nuanced and how open you are with your ambitions when you're coming up, but keep a clear-eyed vision and try to direct yourself as in a straight line path to that goal as you can. For me, I actually think it's been quite circuitous. What I did in that academic path was, I think the one thing that I felt like I did right was identify gaps that I saw with existing health policy leaders. So, you talk to a health policy leader right now, they're either usually an academic that sometimes struggles with making their empirical findings or research findings real to Joe public, because there's that gap in communication. You talk to a health policy leader that's an elected official, many of whom I really admire. A mentor of mine, Tom Daschle, is former Senate Majority Leader. What he lacks is, in some ways, and he'll be the first to acknowledge this, is he doesn't really have any grounding in clinical medicine. And so there's that, to me, there's that gap out there, that the health policy leader who can communicate, who understands the nuances of diplomacy, who actually has been on the front lines and can speak with some authenticity when it comes to, for example, COVID. Because the thing I hate, and I'm sure from what I've gathered, at least from others, is, we're tired of armchair experts that are on Zoom calls all day thinking that they know how to treat COVID or what's the best solution for this pandemic. And so one thing I've tried to lean on, recognizing that, whatever mini platform I have is privileged, is really leaning in on why do I have this platform, and trying to make that real for people so that they don't view me with skepticism. There's a healthy minority of people, I would hope, that are going to push back on anything I say because they listen to the president. And if I'm citing scientific fact, it's viewed that I'm being partisan, even though I don't try to be. But, to answer your question directly, the academic path that I took was not planned. But when I look back, I'm thankful for those experiences and for taking extra time. It took 15 years from, post-college to where I am now, not making a ton of money, really saddling myself with, increased debt, frankly, did a stint in the military. And I feel like that cross-sectoral experience has allowed me to speak with some degree of authenticity on these issues. So that's the piece there that I treasure about it, but obviously some opportunity costs with taking more time.
Definitely.
One question I had for you is obviously the talk of the world right now is COVID. And it's so interesting because, it depending on who you talk to, even from the leaders, sometimes you're going to get kind of a different answer about what they think about it, about where they think it's going, so on and so forth. And I think one of the things that has bothered me kind of about, as I've navigated watching the media through this process, is I feel like there hasn't been good messaging, right? And so I think that, but one of the things that is also clear to me, just because I have family members who are physicians, is that this thing is changing. This is a new thing. It's a pandemic. It's not something that we've seen before. So of course the data is, things are going to change as the data comes in. Tell, from your perspective, what are some of the, frustrating things that you've seen in terms of messaging to kind of the American people? And if you could say one thing to put people at ease, or to give people kind of just a better perspective of how to think about COVID, what would you say?
Mecca, I wish I could, that's such an important question, but it's something I could speak for hours on. At the highest level, I would say there is what scientific fact, whether it's on masking or the right type of testing or expectation setting for the American public on how long this is going to take. And every day there's not going to be some sort of dramatic new headline that's going to suggest we're turning the tide. The lack of consistent messaging on all three has made it difficult for me and my colleagues, when I put on my clinical hat, to do our job, to convince people that our greatest asset here is public cooperation. And so the president, speaking, it's hard to mince words here. The president has not done himself any favors, in my opinion, not trying to be partisan, but, this notion that we're his adversaries versus we could have been his allies, and that the quickest way to restarting the economy was actually just doubling down on stringent health-based policies up front. Had he done that, had he listened to the Fauci's of the world up front in February and March, when they weren't constrained and they weren't trying to temper their advice, think he'd be in a much different place electorally, and I'm sure he rues some of his decisions. Maybe he doesn't. I don't know. But for example, the lack of a national lockdown, up in March. If we really want to cite what Wuhan did or what Lombardy did as an example of that was the ideal approach, so let's be clear, there's been 50 different approaches in the United States across 50 different states. And that's why we have what we have. I mean, it's an embarrassment that we are not able to do this. I have colleagues across the world in public health, and they look at what we did, and, few of them actually envy America as it is. This notion of American exceptionalism, I think, is elusive now, and our response to this pandemic is proof positive of that. So it's one, the lack of consistency in approach. Even if a governor has to implement a strategy or a mayor has to enforce a strategy at the municipal level, if you have the president basically enabling bad actors to not do what's right for their people, then of course a Governor DeSantis is going to do something that's utterly idiotic, which is you shut down for 3 weeks. And if you look at Open Table, their data suggests people were indoor dining in Florida by the first week of May, and they didn't shut down till the middle of April. They shut down essentially, sort of Perry shut down for 3 weeks. And then he was boasting that all the public health experts on TV are, just pundits. They don't know what they're talking about. And, he's overseeing now to this day, still one of the top states that's being afflicted by the virus. So that's one. Two, the masking debate, just 2 days ago, started the DNC. The DNC is virtual, and at the same time, the president's in Wisconsin overseeing a rally where no one's masking in addition to him. And yet, Joe Biden is in Delaware, and the entire DNC is being held virtually. It's just the contrast in imaging and optics. A lot of this is about public health communication. And a Fauci or a Birx can only do so much. I can only do so much on whatever small pedestal I have to push back against the podium of the presidency. And so that on masking, that's particularly frustrating because we know that if there was broad adoption, 95% in public across the country, that this could, the transmission would be tamped down significantly. And so the fact that this has even become politicized, we've talked endlessly about this, but that is, it's malpractice, and it's, if the purview of any governor or any elected official is to do right by their people, you can look at across the country and say there's a lot of people who've just had dereliction of duty, who've engaged in it willfully. And why are they entitled to finish their term? They should be recalled. And Governor DeSantis, for example, Governor Kemp, who actually you may have seen countersued, or I think initiated the suit against Mayor Bottoms in Atlanta for her efforts to implement a mandatory mask policy in the city of Seattle, or the city of Atlanta, rather. It's insanity. It's insanity.
Let me ask this as a follow-up to the mask thing. I actually have two follow-ups to that. The first one is with regard to masks. See, personally, I've been wearing a mask since the first week of March, and it always made sense to me. It always made sense to me as something that could be helpful. And, part of it, like I said, is I have physicians in my family, but also it just made sense to me. But there was some kind of mixed messaging happening about masks around that time. And some people have said it's because they didn't want regular people buying up the N95 masks and so on and so forth. But it didn't seem as though kind of the mask thing was being pushed as hard as it probably should have been early on. Go ahead, Vic.
And it came specifically from the CDC, which is part of the confusion and issue. Yeah, no, and I have to say, I think the CDC, I don't know who's heading their comms, but man, they even up until through last week, they have issued confusing statement after confusing statement on whether it's immunity or masking, what have you. On masking, I agree with you 100%. The literature was uncertain back in February, March. And I even said, we don't know, that there's not strong evidence one way or the other in February, March about masking and its ability to tamp down infection because the studies hadn't been done. It wasn't a sexy topic to study. Now there's a litany of pre-published or peer-reviewed studies that suggest masking is essential. And there's a reason why Hong Kong
and all these mega cities in Asia, Thailand, Vietnam, these major countries, a puddle jump from Wuhan, that tend to adopt masks in public by force of habit over years, why they haven't been afflicted by this virus. And we think it's because they're, hate to use this term, but they're mask wearing societies and they're okay with it. And so as we've learned, we've tried to counter message. But this notion that because there was scientific uncertainty and that was communicated, and now we have the humility to, some of us to acknowledge that we've learned, and now this is what we need to do if you want to not get COVID or continue to live this life that we're all leading. I'm not sure that that's a wrong thing, but the problem here is, again, it's willful mixed messaging. It's almost intentional subverting of an effort to say, yes, it may have been this case in February for very understandable reasons, but this is why it is now. But you have the Surgeon General putting out little haikus on Twitter, diminishing the importance of COVID relative to flu. You have the president to this day refusing to wear a mask. You have Vice President Pence going to the Mayo Clinic. I mean, I say this as a pulmonologist putting that hat on. He's going to Mayo Clinic, one of the most prestigious institutions, higher institutions of medicine in the world, surrounded by public health officials, healthcare professionals in masks, and he's the only one that's not wearing a mask. So, and what is he doing? Well, he's basically saying, well, we don't. What they're doing is they're propagating this uncertainty, even though then they're saying, well, if you want to wear a mask, wear a mask. They know what they're doing. They're actually really. I think the president and the vice president get caricatured as being not intelligent. I actually think they know what they're doing often, and they're willfully doing it, and it's pernicious. And so that's why we've had. The initial uncertainty was it is what it is when it comes to the uncertainty, and that's okay. But I think we had humble leaders that clearly communicated that yes, there's uncertainty. I don't think the American people would mind hearing we don't know. The words we don't know, it's okay to say, but how you say it is important.
Yeah, and I think also we talk about Trump often. We talk about the presidency, but I think also there's a degradation of our culture that seems to be happening as well, that they're a reflection of, right? Which is we don't believe in expertise, right? Like I know what I'm good at and what I know. Mecca knows what he knows. You know what you know. In your area of expertise, I'm going to trust you before I trust myself. As a clinician, you probably see this too. How troubling is that from a perspective of, like you said, the armchair physicians, where everyone is, based on whatever their self-interest is developing a position around that. And it seems like there's evidence to support almost any of these crazy positions out here that they can find and lean on.
Yeah, no, this one, I think that's a really important point that you raised. I mean, I find it maddening, and I would love to, I would love to go on Fox and take on some of this nonsense directly. But 99% of the people that have a platform, probably 99.9% of the people that have a platform, either elected officials or otherwise, in my personal opinion, don't deserve it. And that goes for the majority of our elected officials, because the way our politics works has enabled a media industry around it that reinforces many of its our political worst instincts, on both sides of the aisle. I'm not just saying that this is one side is a problem. I think predominantly it's a problem on one side, and I think we both know which side that is. But it's because of who we elect, because of the structural problems in our political systems, money in politics, term limits. We have, generally speaking, old white men in positions of power that will then bequeath that position to another white male, in many cases, because especially in areas of the country that have disproportionate influence in the electorate. And so we don't have a representative democracy. We have a democracy that's controlled by money and sort of the old ways of power. You get rid of money in politics, you get rid of term limits, you make it merit-based. Oh man, you're going to get a ton of primaries where it's just merit on merit going up against the old guard, and you'll see what happens. You're going to see a bunch of people get removed from office, and I think appropriately so. And then once you get the right representatives, you're going to have a media establishment that is going to have to change to changing incentives, because, then there isn't going to be people that are going to feed into this sort of all these false narratives. There's not going to be a tolerance of that. There's not going to be people in Congress using the media for the wrong purposes and vice versa. It all starts with who we elect. And unfortunately, I think we're just not given good choices. And it creates sort of these downstream events where we're having talking heads on media, just like, emphasizing points that we shouldn't even be talking about, but we do because we have the wrong people holding power. And so that's the proximal problem, in my opinion.
Yeah.
And that's the, one thing that is crazy too right now, particularly for someone in your position. And I maybe it's like a plumber or something with a faucet that's has a hole in it, right? And if the person that called you, 2 weeks ago, you could have fixed it and it would have been no problems. But since they didn't, it's going to continue leaking. And now you have to figure out, okay, how am I going to deal with this leak? And it seems like a lot of the healthcare professionals now, a lot of the things that they would have advised, like you said, like a national shutdown, the type of things that are mandatory to actually stomp this type of thing out. We've already missed that boat. And that boat is probably not coming again in this country. So now we actually have to deal with the data as it is now and the circumstances as they are now. How difficult is that, basically trying to come up with policy or, any type of advice, knowing that we've already kind of missed that boat and this faucet is leaking?
It's, Mecca, it's impossibly difficult. And, part of the reason why is, and I think we have to acknowledge this, is that a lot of people are experiencing really terrible economic times. Unemployment's at an all-time, in terms of like just month over month, we haven't seen unemployment rates increase this dramatically for my lifetime. This is worse than the Great Recession, and yet here I am, and here are others of my ilk saying we actually need a national shutdown. And then you say that to somebody, they're like, "What the hell? What's 6 months of sacrifice been?" And the truth there, and this is why leadership matters. We've just had the wrong type of shutdown. And if we had done 8 to 12 weeks up front, early on, when things were not looking good, we would have gone the way of Europe and many parts of Asia. Yes, we would have had some pockets pop up again, but then hopefully we would have had a smart testing plan in place by then, so we could contact trace. Right now, part of the reason why testing is terrible in the States is that every part of the country still needs a lot of tests. And we don't have the right tests up front. Here, I don't know if this, I think this is just podcast form, but if it's not, and people are actually looking at the video, something that I'm helping to vet for organizations across the country is this rapid point of care testing. And it's the type of testing we need. We talk so much about more tests. Truth is, tests have declined to 650,000 tests a day from 950 about 2 weeks ago. Part of the reason why is people just are sick of it. Nobody wants to get a test anymore because it's useless. If you don't get a test result within 24 to 48 hours, what good is it? And so, but we continue to have strains because we haven't, the UK, Italy, South Korea, these places that had terrible spikes right around the time we did, they don't need to test now basically a huge proportion of their population persistently for months and months and months and months, because they were able to manage things to variable degrees of effectiveness, but certainly better than us. And so the fact that we continue to have these problems, I'm worried more than I was in March, because public patience to hear we need a shutdown is at an all-time low. Public trust, broad public trust, the type of trust that we need. And I'm not saying 40, 60%, the 90% trust level that we need in science is just not there, because we have the president and his surrogates undermining it. And so we should be worried with schools opening up, with organizations moving ahead whether it's professional sports leagues to public schools, we're reopening up. And we're reopening up, I think, arguably at the worst time, with low public cooperation, low public tolerance for what it's going to take, understandably so. And then the flu season on the horizon. So I think there's a lot of things to be concerned about as we move into this phase over the next few months.
One other area with this that's talked about a lot in media is a vaccine, right? There are many vaccines being developed. Anyone who understands vaccines knows the challenge with developing a vaccine and the timetable oftentimes being decades. Where do we stand? Two questions on this. Where do we stand with vaccines? And then the second thing is this kind of anti-vax culture that's rapidly increasing in the US and specifically being spread out into minority communities. What are the challenges? Where are we at with the vaccine? And how do we kind of solve this kind of anti-vax culture that's developing in our country?
I'm really glad you asked that, this one. I looking at the data, I don't know how anybody that's credible could look at the data and then message and say that we're going to have a vaccine that's broadly effective by Q4 or Q1, by Q4 of 2020 or Q1 2021. It's just the data is not there. There's no way to do a trial safely. And oh, by the way, the trial that's being done on one of the leading contenders is an AstraZeneca University of Oxford study that's being done out in the UK. And they're enrolling, get this, they're enrolling 9 out of 10 enrollees into that study, that phase 3 trial, the trial that we need to understand if their candidate vaccine is broadly effective. 9 out of 10 of their enrollees are Caucasian.
Wow.
And yet we know that Black and brown communities disproportionately bear the effects, the ill effects of COVID-19. So how does that make any sense? So we don't have the right type of ethnic diversity in these vaccine trials. There's no way we're going to get the type of safety data that we need in a way that's going to convince people, yes, give me a shot of that by the end of this year. And so what we've seen are bad actors, like the Russians put out these headlines saying, hey, they're mass producing this dose of the vaccine. I don't know anybody that's excited to get the Russian vaccine. But you know what I do know is the Russian vaccine is going to cause people to pause and hesitate once an American approved vaccine is on the market, because now people are saying, can we trust anything here? Are we actually going to harm ourselves? So the anti-vaxxer movement has been strengthened because this has become all political. And now people don't trust the process. They think the FDA is going to cut corners. I have to say, I'm worried about what that vaccine is going to look like, because this is unprecedented, one. Number two, if we don't get this right, people are going to get a false sense of security that if they haven't already been exposed, that a vaccine will protect them. So it's the double dilemma here. We're taking something that's complicated, that requires respect, scientific respect, it requires humility, and we're being really, some of us, the Russians and others, are being brash with it. It's going to cause, I worry, much more harm. Once we do have a candidate vaccine, it's going to cause a lot of people to say, you know what, no thanks. It's going to cause some people to say no thanks to a flu vaccine, which we're desperately trying to convince people to get, because God forbid there is a double pandemic of flu and COVID-19. But all this has done is cause people, and anti-vaxxers in particular, to strengthen their foothold in the broader debate about should you or should you not get vaccinated, and that's really unfortunate.
So it's interesting because this is, I don't want to say it's all doom and gloom, but it feels that way in a way, because all of the things that you would think that you would need to do or have in place to kind of stamp out a pandemic, like you said, a shutdown, masking, buy-in, testing, now the vaccine situation, it seems like that all of those stages, there are major issues with all of those stages. And to me, I'm looking forward, and just as a non-medical expert, I say, we're screwed. Like, we're screwed. And not just nationally, internationally, but definitely nationally. And I just don't know how to feel. So I guess my question is there anything positive that's happening that we can look at, that we can say? I know this new saliva direct test is being amped up in the media. I'm not sure if that's worthy or not, but is there anything positive that we can look at that we could say, all right, just take a step back and breathe. There's going to be carnage, but we can get through this thing.
Absolutely. I didn't want to lead with this because I want people to remain vigilant and alert, at least to the extent that people will listen to me. I think so. And just talking to the Saliva Direct folks, actually, I'm going to, excuse me. They, as you know, worked with the NBA, and the NBA is proof positive that using a spit saliva sample to test for COVID-19, something that there's been a lot of lack of clarity on. Is saliva actually a good test to screen for the presence or absence of COVID-19? There's not clarity. There still isn't enough clarity. But the NBA, the bubble in Orlando, has actually done pretty remarkably well here. And that's used saliva sampling as its primary testing modality. And so I was just on a call with NBA officials recently and the scientists out of Yale, and that was their argument. Listen, it's not a perfect test, but look at what we're doing in Orlando. So I think that is absolutely cause for optimism that maybe this testing bottleneck that we've gotten nauseated by hearing about every single day for the last 6 months, there might be relief because it's an open source platform, meaning if there's no proprietary technology. The Yale folks are not looking to profit off of this. This is just common knowledge. Any lab can run it. So that's really a breath of fresh air to hear, because there's a lot of companies out there that are looking to profit off the pandemic, and this particular technology is meant to be broadly utilized, not just in the United States but across the world. So I think that's exciting. Number two, I would say for your listeners, there's some encouragement that in spite of the carnage in Texas and Florida, elsewhere, Georgia, because of poor leadership, you haven't seen the spikes. That second wave or that sort of mini wave happen in places like New York City as they reopen. They're actually thinking about opening up New York City public schools. And there is a sense here, and you may have seen the headlines, that there's actually greater progress towards this concept of herd immunity in places that were really hit hard. So the Londons of the world, the New York Cities of the world that bore the brunt of the March-April wave, that maybe antibody testing, so antibodies is one way that we develop immunity towards a virus or bacteria, but there's a different mechanism that we don't talk often about because it's a little complicated and it just confuses people. But it's something called T-cell mediated immunity. So it's a different type of cell in the body that fights off viruses. It's actually the type of cell that's depleted in the setting of the HIV infection. But we think there's studies out of Sweden actually that suggests that even if you are antibody negative but had documented confirmed COVID from a PCR test, that you have evidence of this different type of immunity, this T-cell immunity. So that's great news, because then what that tells us, okay, maybe we're underestimating the number of people that have been exposed and have durable immunity for a period of time to COVID-19. And maybe that's why New York City hasn't experienced the second wave or the second mini wave that we would have anticipated, because all these other places across our country are that are really dense are experiencing these sort of mini second waves.
Yeah, and one quick follow up to that too is you mentioned kind of not leading with certain things because you want people to stay vigilant, and that seems as though it's like something that's been, really, really important in this time period, like we talked about messaging. And sometimes people will mistake that for you being a fear mongerer or, pushing fear and all this type of stuff. But it appears that if you because of how serious the situation is, you can't really let up off the gas too much, because people are very much influenced by the messaging. And it's very unique. And this pandemic is unique. I guess every pandemic is unique, where you actually really do need buy-in from the people. So this must be a difficult time, because I know people probably call you a fearmonger. I'm sure that happens. That happens to me. If I haven't mentioned anything about the pandemic, you're pushing fear. But it's like, no, this is actually something that affects us all. And so a question about kind of that, right? Buy-in, you know, and as it relates to kind of sports and reopening things, you know, and even waivers. And some of this is technical legal stuff, but, you know, people want to say, oh, open everything up. The players are, you know, these young players, they're healthy. You know, they're not going to catch it. Why are we, you know, it's for older people or people with pre-existing conditions, all this stuff. But what's unique about this that's different from like even CTE or a broken leg is that even if you are going to be healthy, one person catching it is a disaster because of how contagious it is, and they could take it back and spread it to somebody else. When you evaluate kind of reopening, particularly with schools and sports from that perspective, what type of advice are you giving to people? Especially people who can't afford to do the NBA bubble or don't have the logistics set up to do the NBA type bubble.
Yeah, I mean, Mecca, you touched on a really important point here. I guess I'll before getting into schools and sports, I'll just say on the fearmongering piece, you know, on Twitter and elsewhere, I'll certainly get the occasional comment to that effect that you know, somehow I'm profiting, or the medical establishment is somehow profiting off of continued fearmongering on COVID. Mm-hmm. And nothing could be further from the truth. COVID has actually decimated hospitals. It's caused a lot of people. My wife's a pediatrician. She's had to scale back her practice. Her MAs have been furloughed and then laid off. This has really decimated brick and mortar hospital systems. Mm-hmm. And so this notion that somehow we're doing great is it couldn't be further from the truth. But again, there's bad actors out there who like to propagate that we have perverse incentives here. I don't listen to it. I try to tell it how it is. And I think we need people to be I want to say the pit bull for Fauci, but we need surrogates that are strong, that can amplify and say what we think Fauci probably wants to say directly, but do it ourselves. And so that's the role I've tried to help amplify or exercise rather. Right. To your point on schools and sports, this is tough because what you don't want is a situation that's happening across the country actively, where you have elite private schools able to do things and afford things like rapid testing or plexiglass between student desks that are many feet apart because they just have a ton more space than an inner school district that's public in the middle of Chicago, downtown Chicago or New York City. You don't want to create haves and have-nots, but of course we are, because we have a president and an administration who says if you don't reopen schools, the money per student can go with the parent, and the parent can take it wherever the heck they want. That is a threat. That school districts that need that funding will be defunded if they don't open up in a testing constrained and a PPE constrained environment. There's a lot of nuances to what it's saying, but it's pernicious. It's a threat that your school district will be defunded. And oh, by the way, we're not going to give you any of the necessary subsidies you need to get rapid testing for your teachers and custodial staff, what have you. So what we're doing is we're creating haves and have-nots, and the president and his administration are propagating that reality. Major League Sports, I, for one, love that we have the NBA playoffs and we have distractions now. But if you ask parents across the country, we're in the middle of a pandemic. People are suffering. People have lost their jobs. Why is it that the NBA and MLS and all these companies are able to co-opt lab-based infrastructure that's precious to test their players and families every single day? And some other people, healthcare workers, other essential staff, teachers, custodial staff, grocery store workers can barely get a test.
Yep.
Yeah.
That is the ethical dilemma here. So even though they can afford it, at the end of the day, it's about supply constraints, right? And so there's a con here. There's the mental health benefit of, God, we need something. We can't just keep watching ESPN Classic. But at the same time, we're in the middle of a pandemic, and these things take 1 year to 2 years to normalize. And I get that we haven't. The last event, I remember this, leaving Maumee Valley, actually. My first day in college was 9/11, 45 minutes south of New York City. But that was a localized event, and most of the world continued on, even though the next 15, 16 years were defined by the global war on terror. This is much longer. It's brought the world to a standstill, and I think it's going to be the defining event for many generations for the next decade plus to come, at least. Because then we also don't know when the next pandemic's going to happen. I mean, in the last 10 years, how many pseudo pandemics have basically occurred? H1N1,
Right.
Zika, Ebola. It's almost never ending here. So my concern here is not just about how do we get out of this one, but how do we prevent the next epidemic from becoming a pandemic and bringing us yet again to our knees.
Yeah, one other area I wanted to talk about is you spend a lot of time and invest a lot into actual healthcare policy, right? And before this pandemic hit, it seems very clear that we were already in a healthcare crisis in the United States. Where do you think we stand with that? How has COVID kind of accelerated that? And what do you think are the major challenges that we can fix and need to fix immediately through COVID and at a macro level with our healthcare system? Because we have capacity issues, we have insurance issues, we have so many issues that we keep kind of kicking down the road that I'm scared that if we don't address, we are going to be in a really, really, really big problem.
I mean, this one, no truer words have been spoken. This is unearthed. COVID has shown that if you don't have access to durable primary health care, and that means even up until May, that actually meant you don't have access to primary health care, that you don't even have access to a telemedicine provider to get a test, that those individuals do worse from this virus, that any pre-existing condition untreated leads to a much worse outcome from COVID-19. So what do we do? When it comes to just basic common sense, everybody needs to have access to basic primary health care. And I think we're going to see it's going to be easier to finance that. So if the big debate here was the cost of it, well, one, we know that having a pandemic where people die just costs greatly more than just making sure everybody is healthy and well and might be able to fight off the next pandemic better. So it's cost effective to cover everybody. But it's going to be easier to do so because now people are more willing to consume healthcare in the tele environment. By definition, they want virtual healthcare because they don't want to go into a clinic where everybody else is potentially coughing. So people are going to be much more mindful of how they consume healthcare and are more open to the idea of, okay, I can do it, via Zoom potentially, or via a different type of tele platforms. I think the idea of getting to universal basic primary healthcare coverage will be easier because we have different options that we didn't previously have because the American people are willing to explore different venues as a result of this pandemic. That's one. Two, we need to make the legislative landscape that has changed pretty dramatically to the credit of CMS in the last few months with respect to telemedicine permanent. So there's a lot of changes that were made. Governor Cuomo, for example, removed out-of-state licensing requirements for physicians and other providers to come in and immediately help New York City in their time of need. We need there to be less paperwork that causes needless expenses and waste in healthcare, so that physicians and other healthcare providers can travel across state lines very easily, can be licensed across states. We need the legislative landscape on telemedicine to become permanent. What do I mean by that? I mean that we need a physician sitting here in Seattle to be able to provide telemedicine care to a senior citizen in Florida, because we have healthcare cadre, we have gaps in the healthcare workforce across the country. But if we think about making some of these changes, out-of-state licensure requirements, telemedicine, progressive policies on telemedicine permanent, that can help really make sure that everybody is provided care, regardless of whether it's a doc in California providing care to somebody in New York in a virtual way. So that's important. And then broadly speaking, pandemic preparedness. I'm hoping that we reinvest in preparedness. What does that mean? That means the national strategic stockpile. Both of you guys should know, if you don't already, that we all of our essential medications get mass produced in China and India, and then get sent over here. Penicillin has been produced in the United States since 2004. And how often do we stoke a potential war with the Chinese? And they have an ace. They have an ace under the table there. If they wanted to, they could say, we're not going to give you any more essential medications. So we need to develop supply chain independence on essential medications and other pharmacotherapeutics. We need to not rely on KN95s mass produced in China as for PPE purposes. So we need to be able to say, okay, if there's another pandemic, we have a stockpile of ready, non-expired, high quality masks for healthcare providers, for teachers, et cetera, that's not coming from overseas. We haven't vetted the quality of those masks. We know that we have PPE that we can trust at scale. It was a big, big issue early in March. So we had PPE that just was not of high quality coming out of places like China that had not been vetted. So we need supply chain independence on medications, on essential medical equipment. And then I think we also need to think really broadly about two more things: a pipeline for diagnostics. We lack public-private partnerships. We lack a BARDA, the Biomedical Research Defense Agency, as part of the US government that's adequately funded to think very progressively and long-term on issues like a diagnostics pipeline, so that we have rapid point-of-care tests that are actively being developed that can be co-opted and minimally modified when the next COVID 2022 or 2023 arises. That we have people thinking about, okay, how do we get something that's quick, that's accurate, that can be changed based on the genetic sequence of the next virus quickly, so that we can get it out there and mass produce it, so we don't have a testing crisis again. That we have a vaccine platform that's agile and that can also be altered quickly based on changing realities on what we're seeing in the microbial ecosystem. This is what we need. We just don't have the right people. We don't have the right funding. But if we get those in place, I think that at least we'll be able to mitigate the impact of the next epidemic of pandemic potential.
And I wanted to ask one follow-up on that real quick, since you mentioned it. We're also, the CDC and the World Health Organization are under fire, right? And their funding has been cut by us. Could you just underline the importance of those two institutions and why we need to fund them and make sure that they have the resources from America that they need?
And simultaneously, and also I want you to speak on a little bit of some of the criticisms as well, because I don't, they've done some, both of them have done things throughout this that I question, and I'm not even a physician. So,
yeah.
And we're talking about the WHO.
Yes, and the CDC. It seems like the funding has been cut from those organizations.
Yeah, I know Trump was threatening to cut the funding from the WHO. I'm not sure if that actually went through. The people have been very critical of them, but also a lot of people say, but no, we need the World Health Organization. Let's just take one at a time. Let's start with the World Health Organization. What is your kind of feeling about them, how they've handled this, and what their value is, their greater value is to kind of the world?
I'd be the first to say that the World Health Organization is not what we need it to be, but if we didn't have it, we'd have to invent it. And so disbanding it, making these broad proclamations that we're going to defund it is the exact opposite. It's just all political optics and showmanship on the part of the president. It's not going to meaningful. It's all it's going to do is to make us unsafe, because we need the World Health Organization, which is still viewed as credible across 195 countries worldwide, all of its member states. They still adhere to a lot of its doctrines. The World Health Organization has an ability to convene people in ways that we cannot, because we've lost a lot of global political capital. So us going out and saying the things we've said, continuing to do, the truth here is that we've been defunding something called the Contingency Fund for Emergencies since the Trump administration came into office. It's called CFE. If your listeners Google it, they'll find that our contribution to the fund that allows the WHO to respond to emergencies before they become full-blown pandemics has been $0 for the last 3 years.
Wow.
And so this notion that we're blaming them now for not being adequately responsive, we're to blame for that. It's not their fault. We are if we want to lead the world in terms of setting the rules of engagement for these multilaterals, in terms of dictating what the WTO, the World Trade Organization, does and does not do to the benefit of our economic growth, then we have an outsized responsibility to fund and make sure resources like the CFE for the WHO are adequately resourced. We can't just pick and choose how we choose to engage with the world. We need to own the responsibility that comes with our place, our pole positioning when it comes to economic growth and just what people look up to when it comes to America and this ideal of us. So the WHO needs to be funded, and the president has deeply harmed global cooperation. And there's no notion of blocking off America. I mean, this ridiculous conception that we can just stop flights from coming in from China, and therefore that was going to be the policy that was going to protect us. Actually, it's been proven by the Council on Foreign Relations. They did a really wonderful analysis that countries that didn't impose blockades on travel versus those that did, the countries that banned flights early on, like the United States, actually had vastly worse outbreaks than those that didn't institute those travel bans. Not saying that at some point stopping global commerce and travel isn't a smart idea, but that's not the backbone of a pandemic response strategy. Mm. But the president, he continues to message on that as though that's the sign of effective leadership. That's not. That is not the sign of effective leadership. And pandemics ultimately find a way, is the point. And that if you stop global commerce, if you stop global travel, you actually stop the supply of essential technical expertise and needed supplies like we just talked about. Asia Pacific supplies came to a halt in February through the end of April. And you know what came to a halt with that? Essential medications to us, essential PPE to us. So there are consequences here about saying we're gonna engage with a tit for tat on global travel bans. They don't work. They're not the backbone of effective leadership, and all they do is harm a broader strategy here. But the WHO, to your point, critically important. We need it well resourced, well managed, and that's the tip of the spear, and whether we like it or not. The CDC. Go ahead.
No, definitely no. Go ahead.
I think the CDC last week they issued this really confusing set of guidelines here on. You may have seen this notion that if you tested positive for COVID-19, that you're arguably immune for the next 3 months. It was the upshot of this headline. And all of us looked at that, the actual guidelines they posted on the website. It was maybe 3 lines, no cited material. And we were like, what the heck are they doing? These are supposedly respected public health officials putting something out there that doesn't have any cited information. And the reason why they didn't cite anything is because this area is still yet to be determined. What does immunity look like after COVID-19? And yet the CDC is putting its authority behind a statement suggesting to the American public, if you've gotten COVID-19, tested positive, you no longer have symptoms, you don't have to quarantine if you've been re-exposed again for the next 90 days, is what they basically said.
Yeah.
And that was consequential. And so they've become unfortunately politicized, as is the FDA in some cases, and and we don't need that.
So one other thing, I mean, that's shameful, and it's sad because I think, going back to our earlier part of our conversation, when you're talking about buy-in, it's just hard to get people to buy in, particularly people who are already skeptical of government and politics. Those type of things just create additional confusion, and people say, you know what, I'm just gonna do whatever because I read this from this credible source, and then I read this credible source, and they said the exact opposite. What am I supposed to do? But one of the things that V's earlier question touched on, I want to touch on before we get you out of here too, is that this pandemic has taken over kind of the headlines, but there's still a ton of issues that relate to healthcare that are still going on right now that probably aren't getting enough attention. And I know you've spoken on 2 of them, gun control as it relates to health. I would love to hear your perspective on that. And then also climate change's impact on health. And those are things that I think, maybe are conversations that were bubbling up that are have kind of gotten drowned out a little bit by this pandemic?
Super consequential. This gun control is, it's yet another example of individuals without backbone. And the fact that we even have to have this conversation, it just is emblematic of the failure of our leadership. Again, people misconstruing and for the wrong reason, perverse incentives, twisting and warping the definition of the Second Amendment, the right to bear arms, to justify a reality that, to push back against a reality that I don't think the founding fathers ever dreamed of. This notion that we would turn guns against ourselves in these massacres. There needs to be an assault weapons ban. There needs to be all types of regulations when it comes to taking back arms from individuals that may have purchased them that then ultimately have a diagnosis of some sort of mental health disorder. For example, these sort of red flag laws here need to be implemented across the country. There should not even be a debate on an assault weapons ban. I have colleagues across the aisle that I work with who justify it to me on the grounds of hunting or sporting. And if that must be the case, if they must use an assault weapon or an assault-like weapon to sport, then I think there's solutions around that, like what the Chinese do, for example, or what the Indians do, which is if you need to do it, you got to get a doc's note. You got to get certified in proper safety techniques, and then you know what? That weapon is going to get stored at a third-party facility. It's not going home.
Right.
And that's where we're at. And this is not hard. This is actually not difficult. But again, because we have the wrong elected leaders in place, in many cases, people use this as the backbone of a reelection strategy. It's absolute insanity. And then there's and because of media, unfortunately, this is. Sound bites are what they are. It's a glide path for people to get victory and then to run on this cause and to develop some sort of caucus in Congress just specifically aimed on this cause. It's nuts we tolerate in what the existing reality. On climate change, I'll quickly say that there's more and more data suggesting in the last 2 years that air pollution is an independent risk factor for early death and disability. And now there's more rising data suggesting that exposure to air pollution actually upregulates an enzyme in the body that allows COVID-19 to more easily enter lung cells. And so what are we saying? What we're saying here is that communities that have been long afflicted by poor air quality happens to be happens to be rural communities filled with immigrants, happens to be brown and black communities across the country living in inner urban city areas that don't have enough ventilation, that when they open up the window, they're inhaling actual polluted air. Yeah. That air actually is an immunosuppressive risk, is an immunosuppressant, and it predisposes to infection or to worsened outcomes with COVID-19. So climate change is rearing its head in so many different ways, but in particular with this pandemic, it's worsening outcomes.
One last question before we ask you a couple quick fun things to get you out of here. Is that I've read that you have recently come on as kind of the chief scientist for Amazon Care and have previously worked with Apple. Just generally in our country, there's a sense of fear that these companies are becoming too big. They're entering too many areas. But I kind of see the opposite, right? You've mentioned throughout this conversation that funding is a big issue that we have, and we have a lot of healthcare challenges. In your work with these large corporations, what are you seeing, and what role do you potentially see a company that's as big and powerful and as smart as Amazon potentially playing in helping solve some of these issues?
Absolutely. That's part of my life right now is part clinical, part public health advocate. Still have an academic role, and then I have been helping Amazon on some of their internal COVID response efforts. What I can say from my few months of my perspective there is what they are able to do with their reach and resources puts the government to shame. And when used for good, we can all have our opinions on the private sector world, but I think there has been too much because of our political debate, there hasn't been enough effective collaboration across sectors. The public-private piece here has been devalued because Amazon or Apple or Google, there's this narrative out there that they're a bad actor. What I've seen on the public sector, public health side is that these are companies that can move quickly. These are companies that are doing a lot of good. Actually, they're able to, I can quickly say that we're, at Amazon, we're funding multiple clinical trials, one of which is on plasma, to determine whether or not it's an effective treatment for those with critically ill COVID-19. We're looking into multiple different ways to test rapidly for the betterment of the country. And if we can use our logistics muscle to scale testing for school districts across the country, well, then that's something that we'd be filling a void in because the government hasn't stepped in. So I think it's a broader commentary to say that the private sector, especially in this age where the federal government is so politicized, so ineffective, 6 months we don't have a testing strategy that's unified. We need the private sector. And unless we have a leader saying what's the best for the private sector, what's the best of academia, what's the best of the public sector, let's bring them all together in the same room for the betterment of the public good, we're just going to continue to be circling our wagons here. So I personally, I've embraced it. And I think that they, from what I've seen, I spent a year in the CDC and on the public sector side solely. I've been astonished by progress and just the ability to effectively act quickly.
We got 2 fun questions before we get you out of here. This has been phenomenal, and thank you so much for joining us. First question is your top 5 musicians of all time.
Oh gosh, yes. I would say, in no particular order, U2, Smashing Pumpkins. That's from my Mommy Valley days. Radiohead, and just because I was listening in the car, dropping off my child just now, Puff Daddy.
The fact that you call him Puff Daddy, you age yourself.
You've been with him for
you haven't gone by that for like 20 years.
You've been with him for years.
All right, one more.
This one I know you have a solid answer to. Your top 5 athletes.
Oh yeah, this is easy. At least number one has. This is before what happened. I can't believe this happened this year. But Kobe Bryant has. I actually have this jersey like right next to me. But a lifelong Lakers fan, lifelong Kobe fan, and gosh, I just can't believe we lost. What a terrible year. But
right, seriously.
But definitely him at number one for a variety of reasons. But I would say. What I loved about him was just the sustained excellence, no matter what he did. Mm-hmm. It was excellence through and through from the beginning, and he shot for it. And man, what an example of to look up to from. And obviously, personal failures, of course. And I'm not excusing any of that stuff. And I feel like you have to qualify any comment of praise on Kobe, which is the indictment, I think, of our times. But what I would say is, few people across sectors have reached such excellence, and I mean, what an amazing person to look up to from that standpoint. Jordan, flu game '97, hard not to love that. Man, after those two, since I'm in Seattle right now, I'd have to say Russell Wilson is number 3 right now. God, those are top 3. I'm a Dodgers fan, so Ramon Martinez, I don't know if you guys remember him, but he was the Dodgers ace in the early 90s. He was always somebody I look up to. And then
you can say me, man. You can say me.
This one's air crossover. I would say, and then Nick Van Exel. I don't know if you guys remember him.
Yes, of course.
Nick the Quick.
Nice.
That guy, man. I just remember growing up watching him all the time. So those are my top 5.
That team is probably the only Lakers team that I really, really enjoyed.
Yeah.
Dr. Gupta, this has been really, really good. Thank you so much for taking the time for us. I mean, we see you everywhere. Like I said, I see you on TV pretty much every night. You've been doing an amazing job. You've been a great mouthpiece. I think you, like you said about Sanjay, I think you also bring a calm that I think is also necessary during this period of time. And so we just, want to applaud you for what you're doing. Keep doing what you're doing. And once again, thanks for joining us on the podcast.
Yeah. Keep making us proud, man. And next time I'm in Seattle, we're going to have to catch up.
Absolutely. Thank you, guys. This is a privilege, and thank you. Thank you for everything.
Valley boys, we get on up.